what we're truly going to be talking about is a specific syndrome, and it's got a curious title, the Diogenes syndrome. Now, when I first saw this, I thought, Diogenes, wasn't that the Greek guy who held a lantern and he was looking for truth, looking for an honest man? And in fact, Diogenes is known for that. So what the heck does this have to do with hoarding and the elderly? Well, as of 2011, this is a recognized syndrome. It's not yet a diagnosis. And it's got 5 specific components, and there they are. So it's a behavioral disorder, clearly. It's a problem with behavior. Of the elderly, typically 60 and above, although there are some middle-aged folks, it's rare, that manifest this. And there are the 5 components. Number 1, extreme neglect of self. Number 2, domestic squalor. I just love to say that word for some reason. Number 3, social withdrawal / refusal of help. Leave me alone. Number 4, an utter disregard of concern, which to the casual observer is an appalling situation. To the patient with Diogenes syndrome, they're indifferent. Nothing wrong here. And then the last one, if nothing else, what you'll get today is a new word that you can throw out at the next cocktail party. The 5th component is solagomania, which is a tendency to hoard rubbish excessively. To hoard rubbish excessively. Now, Diogenes syndrome has some other monikers. If you look in the geriatric health literature, you'll sometimes see it described as senile breakdown or social breakdown, senile squalor syndrome, or the one that I like, because I'm a simple guy, is messy house syndrome, although I think that's a grave underestimate. So there's our 5 components: extreme self-neglect, domestic squalor, social withdrawal, lack of concern, indifference, and hoarding rubbish. So I want you to put your thinking cap on and think about psychiatric illnesses that you've heard of or that you know of, and where these behaviors are evident. And as you think about this, probably some of these psychiatric diagnoses will come to mind because they contain components of these 5 pieces that make up Diogenes syndrome. For example, depression. So when patients are sorely depressed, they have low energy, low interest, they don't take care of themselves, they don't groom themselves as well as they usually did. They're kind of indifferent to what goes on around them. Dementia, folks with severe dementia, they lack the judgment, to make the right decisions. As the dementia progresses, their grooming often deteriorates because they forget how to groom, if you will. They require a lot of assistance. There's a subtype of dementia, frontal lobe dementia. This presents initially not with memory loss, but with behavior changes, personality changes, dramatic changes in personality, loss of initiative, dramatic manifestations of poor judgment. People with frontal lobe syndrome behave in public in dramatically different ways than they did before this illness struck them. Substance abusers, well, when folks are deep into an addiction, they just live to use. They live to drug, and often domestic squalor is appalling. Now, most people, when we talk about hoarding, they immediately lock into obsessive-compulsive disorder. But what do we know about OCD? Well, these are folks that have trouble with time, money, and dirt, if you will. They're not generally messy. In fact, they're often exceedingly, excessively organized. Not a thing is out of place. Now, they have compulsive rituals. I mean, by definition, obsessive-compulsive disorder simply means we have obsessions, unwanted, intrusive thoughts that we can't shake. My hands are dirty, I'm contaminated. And these obsessions lead to compulsive behaviors. I can't resist washing my hands over and over and over again. Okay? So I think we think about OCD, but actually if you think about the larger picture, it's rather different from hoarding. But there's that component there in terms of, rituals, if you will. Personality disorder. So one of the pieces here was social withdrawal. Okay? What do we know about folks with these specific, we call them cluster B personality disorders? These are folks who lifelong would really prefer not to be around people. Okay? Paranoid psychosis. So if I'm concerned that someone is going to harm me or hurt me or do me wrong, perhaps, again, I'll be withdrawn, and I'll certainly refuse any help because maybe they're actually trying to get the inside track on me and harm me. Okay? Delusional disorder. So a delusion is simply a false, firm, fixed belief. And when we look at folks with Diogenes syndrome, we say, what are they thinking? Is there some delusion here that if they throw away something, that they're throwing away a part of themselves? What's going on here? And then the last one, just in addition, in folks that have mental retardation, again, grooming can be difficult. In certain types of MR, we can see lots of ritualistic and compulsive behaviors. And there's even a specific rare disease that falls under MR called Prader-Willi syndrome, where these patients obsessively hoard food. So differential diagnosis in terms of psychiatric symptoms, these diagnoses share some of the components of Diogenes syndrome to varying extents. So there's lots of intersecting diagnostic areas. But let's go further. As of today, Diogenes syndrome is not a formal DSM-4 diagnosis. Now, DSM-4 is, I'm sure most of you know, is the diagnostic and statistical manual that mental health clinicians use to specify criteria and make diagnosis, because we can't treat anybody until we know what the diagnosis is. Diagnosis dictates treatment. So as of today, Diogenes syndrome is not a DSM-4 diagnosis. And of course, that kind of leads to problem too. If we don't have a rock-solid diagnosis, Adult Protective Services generally doesn't have a distinct protocol. And they don't, per se, for Diogenes syndrome. These days, they kind of lump it under a dementing illness, although as you're about to find out, half of the folks with Diogenes syndrome are not demented. It's remarkable.